Welcome, and thank you for joining me for this two-part series aimed at helping you navigate through the ocean of information out there about managing your back pain. My name is Lizzie Quinn and I'm a musculoskeletal physiotherapist. I've been treating clients with lower back pain for over 20 years, and my interest in helping those who are struggling with back pain has become a passionate project of mine. And I hope to help you navigate your back pain journey a little easier through this two-part series. I've seen firsthand the effect back pain can have. I have also witnessed how hard it is to find quality information on how to manage lower back symptoms and to move in a positive direction towards a life with improved quality and with a better understanding of your body and your mind. Some people may find their back pain only interrupts their day-to-day life a very small amount, whilst others can be incredibly impacted. And it can be very distressing and really difficult to manage. Frustration is a common feeling associated with lower back pain, and today I would like to ease this a little by talking about where to start to find accurate, helpful and professional advice, and then a little about the best way to help facilitate some improvements in your symptoms. Let's go through this together in a step-by-step manner and run through some helpful key points. Step 1, please turn off Dr. Google. I cannot tell you how many times clients have come in to see me and told me they have been Googling their symptoms. They turn to late night Google sessions trying to find information about their pain, and many of them end up feeling even more frightened than when they started. Google is a great resource to find people who may be able to help you navigate your back pain journey, but it should not be the place to look when you want your back pain diagnosed. You cannot get an accurate assessment and diagnosis over the internet, and generally I found it simply increases your level of anxiety and frustration. So please, if you do this, stop Googling your symptoms and let's leave it up to a health professional to assess, diagnose and to treat. Step 2, visit your local health professional. Starting your road to recovery by visiting your health professional such as your GP or your physio is a great place to start. It is important to get your lower back assessed and diagnosed. You need to see someone who is highly skilled at identifying causes of lower back pain and who can help you understand where your pain is coming from, why your pain is there, and then what to do about it. And we will discuss that point a little more in a moment. You also need a clinician to say, yep, this pain is what we call mechanical back pain, meaning it's coming from tissues and joints in your spine. On a rare occasion, lower back pain can be caused by other sources within the body. And although this is uncommon, it is important to be reviewed by a highly skilled clinician to appropriately diagnose and then manage. But please remember, in the majority of cases, people with lower back pain will have a mechanical source for their symptoms. And the issue then is knowing what to do once you have this diagnosis. But that's why I'm here to help you. Step 3, finding the right roadmap to your recovery. Now, this is often the challenging point. You've been diagnosed with having back pain caused by joints or tissues or muscles in your lower back. Some of you may even have a very specific diagnosis. Perhaps you've had some imaging done, such as an X-ray or MRI. What do you do now? And this is often where we get stuck. We can circle around and around in this space for a long time if we're not careful, even years, trying one thing and then another, seeing one health professional and then another, and it can be really exhausting. Finding someone to help you after you've been diagnosed with lower back pain can be a truly difficult process. So let's break this down a little more for you right now. Key 1, find the right clinician. Finding the right clinician to help can be really tricky. Sometimes the best place to start is by asking your family and friends. You'll be surprised how many people need treatment for a sore back. I've treated people with lower back pain for so many years, and my biggest source of new clients has always been word of mouth. If you're good at what you do, people will talk. So ask your friends, your neighbors and family if they know of anyone who is well experienced at treating lower back pain. Then start by calling the clinician and speak directly with them. And as a general rule, I like to receive treatment from a health professional who believes in and cares about ongoing education. So always check to see if they have any postgraduate qualifications or evidence of further education. This will be a good sign they're up to date with the latest evidence-based research, and they also care about their understanding of lower back issues, and as such, they will care about you also. Find someone who shows empathy and who you feel listens and connects with you. Having a good relationship with your clinician is beyond important. I really feel one of the most crucial roles as a clinician is to truly listen and hear what the client is telling me, not jump to conclusions or cut them off when they're talking. The client should feel understood, heard, and cared for. If you don't feel that you already have that connection with your current health professional, then shop around. There is someone out there for you. It just might take a little bit of research. The clinician not only needs to be caring and empathetic, but adaptable. I can't tell you how many times I've had clients come in and say to me, I'm feeling sore this week after a long weekend standing at a work event, or I had a busy weekend looking after the kids. And with that information, I adapt my treatment plan. I look at what the client needs in that moment. I usually look very closely at their exercise list and make necessary changes, taking some exercises out and adding new ones in. I give them a plan or a protocol as such to follow for the upcoming week so they know exactly what they need to do and when. I don't just simply massage their back and send them on their way. I listen to their needs and adjust my treatment plan accordingly. Key number 2. In what field do I find this clinician? Now, lots of practitioners treat clients with lower back pain, from physios to osteopaths to chiropractors to massage therapists. I'm not going to tell you which one of these health professionals will be right for you, as everyone has their own individual likes and dislikes, preferences and opinions. But here is a way to tell if their treatment may be helpful for the long term. How often do you need to see your health professional, and how passive is your treatment? And what I mean by this is, are you visiting them each week? And if so, during the session, are you lying down on the treatment table and receiving only hands-on treatment? I've seen over the years many clients come to see me struggling with ongoing lower back pain, and at the same time, they've been seen by a health professional each week for many years. Their treatment sessions have been quite passive, meaning they mainly just get hands-on treatment. Lower backs generally don't need weekly hands-on treatment. If anything, sometimes they prefer just to be left alone. This isn't an expensive and often ineffective way to treat your symptoms. You need to be more proactive. Ideally, you should be with a health professional who provides you with goals and has a treatment framework in mind. They should know how long it should take for your symptoms to change, and they should work towards reaching these goals with you. Your treatment should be active. This means perhaps only a small amount of hands-on treatment and more active work, such as exercises including postural training and muscle training to improve your spinal strength and your mobility. The more you move, generally the better you will feel. So find someone who believes in the importance of movement. Now, I have a personal opinion that you should avoid strong stretches for your lower back when you're suffering with ongoing pain, particularly in the first phases of your rehab. And I'll go into this in much more detail in the course, but for now, make sure your exercises are focused more on strengthening your spine than stretching it. Key number 3, education. I cannot emphasize enough how important it is to find someone who can help educate you on your journey. I think part of the reason I started Remedy Rehab was to help clients be well educated on everything back related. Looking at your posture and how best to stand and sit, how to manage a flare up, how to move well, how to unload your spine when it needs a little bit of rest, how to load it appropriately to improve your strength and mobility, what exercises are helpful, what is really happening in your back when it feels tight, What activities should you do and what activities should you avoid, and so on and so on. Seeing a health professional means finding out all of this information and much more. Make sure when you choose a health professional to guide you, they're able to answer some of these questions. Getting some massage treatment on your spine without addressing education and how well you understand your back is unlikely to deliver consistent, positive, long-term results. Key number 4, mindset is everything. Understanding how your mind affects your back pain is really vital for your ongoing recovery. If you're doing hours of great effective exercise each week, but are suffering with feeling overwhelmed, stressed, and anxious, your back exercises will not be as effective. Because of the incredible influence our brain and our mindset has on our experience of pain, I have included mind modules in our back pain course to ensure we're looking at all facets, everything that could possibly affect or have an impact on our pain experience. So it's important that you look at how your mind is coping with not only your everyday experience of lower back symptoms, but how your mind is coping in general. I have some lovely conversations with psychologists during the course looking at how our brain influences our experience of pain, and just listening to their input makes me realize the importance of a healthy mindset when we have back pain. If you feel that you may need some additional help in lowering stress levels or improving your coping strategies for stress or overwhelm, or improving your mindset, then perhaps now is a great time to ask for help. There is a huge amount of information out there about reducing stress and improving your mind. I would suggest you start with your GP, or perhaps you already know a lovely psychologist. But do not be afraid to address your mindset and how you're coping with your lower back symptoms. Remember, back pain is complicated and needs an approach that looks at your entire being, both your body and your mind. So please don't neglect that bit, because it's really important. And quickly, before we move on to key number 5, if you're interested in learning about meditation, don't miss out on one of our key conversations contained within the course where we cover this topic and more. Key number 5, support. Now is the time to ask for help. If you've been suffering with ongoing lower back pain, please don't suffer in silence. Ask a friend or family member to help. Perhaps they can drop a meal around to you, or maybe they can go for a walk with you each week to keep you moving. Whatever it is, gaining access to community support is really important for your health and well-being, not only for your back but also for your mind. We need to feel connected to community, and back pain can cause us to feel isolated at times. We can withdraw from certain activities because it hurts to stand for a long time. So we say no to outings and parties because we're worried about how our back will respond. This withdrawal from social opportunities is not helpful for our mindset and our experience and understanding of our lower back. Stay engaged in your community. Ask for help when you need it, and please remember you are not alone. Back pain is an experience shared by millions and millions of people around the world. It is important to recognize this, ask for help, and make sure you stay connected and engaged with others. It will really help your recovery. We've covered a fair bit of material so far, so before we go on to our next training series, let's quickly recap. Step 1, turn off Dr. Google. Let me assure you this will not be helping. Step 2, get your back pain assessed by a highly skilled physio or GP. Step 3, design your best roadmap to recovery by Key 1, finding the right clinician for you. Ask lots of questions, do your research. Make sure you find the right person and they show empathy and really listen to what you're saying. Key 2, your treatment plan must not be passive, meaning if you're going in every week and just getting hands-on massage or some form of manual therapy and nothing else, it is likely you're not going to improve. Your treatment plan must be swayed in the other direction, more active exercise and less hands-on work. Remember, avoid strong stretches if you have ongoing lower back pain. They will most likely not be helping. Key 3, education. Your clinician should be providing you with oodles of information. Everything from posture evaluation to management of flare-ups, answering why your back is sore, how to improve your pain, and much, much more. If you are not receiving adequate education during treatment, you're missing a really crucial component. Key 4, mindset is everything. We must improve our understanding of how our brain works and how it impacts our experience of pain. Stress, anxiety, and overwhelm will affect your experience of pain. A more flexible and adaptable mindset will greatly influence your response to your lower back pain symptoms. Key number 5, get support. Now is the time to ask for help. Ask a friend to join you on a walk or get a family member to help with some meals. Maybe you could find a small community group that enjoys a particular hobby that you're interested in. Staying connected in community is so important, so please don't isolate yourself. Stay engaged as much as you can with friends, family, and community. Thank you so much for your time today. I really value your time. In the second part of our training series, we will discuss the remaining key factors in helping you to navigate your lower back journey. I hope you can join me. Thanks so much, and I'll see you soon.